We are joined by Dr. Anita Hackstedde, President and CEO of Salem Regional Medical Center and YSU trustee. Thanks for being with us.
Thanks for having me.
For those who aren't familiar with the hospital, just give us an overview.
Well, Salem Regional Medical Center has been here for over 100 years. We are a full-fledged community acute care general hospital. We're one of the only independent hospitals left in the state, in the nation, so it's locally controlled and governed by our board of directors. So we're a unique beast. We're not affiliated with any systems. We do pretty much the wash of all things that hospitals do, so been here for a long time.
What are you most proud of?
We've done a lot of changes over the last few years. We've done the expansion with our private room tower, really focused on elevating the quality of care and having local access to high level of care, because we feel like our community shouldn't feel like they have to go to Pittsburgh or Cleveland for care. So we've worked really hard on our orthopedic program, our cancer program, and our medical imaging programs.
And you also have a partnership with Mercy?
So we work with Mercy Hospital in what's called a clinically integrated network, where providers from different areas can work together to improve quality in the community. So we're part of Mercy's clinically integrated network. We collaborate on how to really elevate outpatient care projects. And then we also have a collaboration with University Hospitals in Cleveland for our UH Seidman Cancer Center at SRMC.
Tell me a little bit about how the COVID epidemic has affected the hospital here, what you saw.
Yeah, so I would say all hospitals were massively affected, and our region did have a bit of a surge back in April, and for a while it was everything shut down. We canceled all elective procedures and just waited. And then the surge did hit, and it hit kind of the different counties around the same time frame. Large volume of patients coming in requiring inpatient care. It was different than what we typically see. I tell people it felt like a war zone there for a while. Our average daily census in our ICU is 3 or 4 patients. It's a 10-bed ICU. We had to turn our endoscopy unit into a COVID unit. We turned our surgery unit into a second ICU area, and pretty much all we were doing was COVID there for a while. And then in our region in particular, the FCI Elkton Federal Prison had an outbreak. And of course we're closest to that facility, East Liverpool, and I know all the other hospitals were impacted by that. But that's one of the great things that you see when hospitals really come together to provide the care and help each other out. That's what I saw during this. And so we all got together, multiple daily phone calls with the region throughout the state. And when we saw, actually when the hospital saw that we were getting overwhelmed with the FCI Elkton patients, they all stepped up, and we had a one-call regional referral center so that we could then distribute patients evenly across the system. Caring for COVID for our staff, it's exhausting for them. Those patients require a lot of intensive care, and so it was nice to be able to give them some breathing room so they can kind of recoup and deal with the next wave that was coming in. So for a hospital our size, we were hit pretty hard, and we continue to see the activity, though not quite what it was back in April, but you just never know what the winter's going to hold for us.
So it felt like there was a time where Columbiana had fewer cases, and then when it started to hit Elkton.
Yeah. So, you know, when we first heard about what was going on overseas, and then maybe it's starting to come into the U.S., you just don't think a little tiny place like Salem's going to get hit. We do a lot of preparation for this. We're always doing pandemic preparedness and emerging infectious disease preparedness. That's not new. We drill on this constantly, but then when you start to hear it's coming, and the first case is in Ohio. I told folks that there's nothing that we knew about this virus. Everything was new for all of us, so I can imagine how the general public felt. And so my analogy was I felt like I was standing on the edge of an ocean waiting for the tsunami to come in and just waiting. We shut things down, did everything we could, and then we just sat and waited, and it was kind of an eerie feeling for a lot of us. And it came down to, okay, how do we do this? What if we turn into a place like what New York did or what Italy did? And is it going to be that bad? And you start to wonder, geez, how are we ever going to tackle that? And when the initial surge projections came out for our county, I said, there's no way we can do this. And so I have to say, putting some of those measures in place, the social distancing and the lockdown, those were absolutely essential, because there was no way we could have handled the volume. None of us could have. So those helped. So the reforecast of the surge was smaller, and it was pretty much spot on for what we saw. And when we started, we started with a trickle, but basically in one weekend, in 3 days, the volumes bumped up, and they were very, very ill. Even despite, if you look outside of what happened with Elkton, that's when we started to also see some community spread, and we started to see the volumes pick up from that. And lessons learned from this are, nobody knew what we were dealing with. This was a virus that was never identified before. We know other coronaviruses. This is different. We didn't have a test for it. And this is all back in January. And so for us to go from that to where we are today, I think has been tremendous. I kept saying they need to let hospitals do what we do best. This is what we do. Let us do this. And when I saw the coming together of all the hospitals in our emergency preparedness region and in the state, that's what we do. And we have some just great thought leaders in that area. And then realizing that we have expertise here. And so sometimes people think, oh, it's a small little rural hospital, they have no idea what we're doing. We're pretty good here. And so when you start to look around and saw the expertise and the time and the commitment and the dedication to keeping everybody safe, that's what really was amazing to me. And so I think we shine pretty bright for that.
So when you look at when it first started versus now,
Yeah.
What did you learn, or was there any major changes in medical care from that first time to what you're doing now?
Yeah, so in the beginning, because there wasn't a whole lot of information, we were doing the medications that were recommended at the time, what we learned from overseas, and then things started to shift. When the first round came in, I keep saying it's a little different now. We're still seeing COVID-19. We have COVID-19 inpatients, but they're not quite as sick as what we saw before. I don't know why. I don't know if that's has to do with the vulnerability of the populations, if that's a change in the treatment that we've done, if that's a change in the virus. But I think that's at least a positive sign, is that it's not quite as severe, and we've not seen the same level of ICU admissions that we had before. So there's definitely been a change. We have our system down pat to use our PPE appropriately. We still do the conservation mechanisms and the ultraviolet disinfection of them. It'd be nice to have access to going back to how we normally use PPE, where we eliminate a mask after every patient encounter, but we still have to sterilize and reuse until...
Did you get enough of those at the
No,
beginning?
we never got enough of those. So that was the big lesson learned, is you can't rely on anybody but yourself. And so we have our own emergency stockpile for preparedness here. The Strategic National Stockpile, unfortunately, did not have much of anything. And we were able to carry in our stockpile on one hand, on what we were delivered from the federal government. And when we looked at the usage of our isolation gowns, it would have lasted me 90 minutes of care. So we knew at the time we had to do something different. And then our community stepped up like I've never seen a step up before, and brought us in homemade isolation gowns and things that we could use. Businesses gave respirators, so we were very fortunate to have that kind of outpouring from our community.
Despite the influx of patients, there were some hospitals that actually had to lay off some people. And how did you help your employees handle this?
Yeah, so this was a very stressful time, and number one, talking to them, they're hearing all this chirping in their ears from whether it's on social media or the news or what they're reading. So there's a lot of disinformation circulating and a lot of fear, understandably. So if you understand that they were reacting to fear. So we spend a lot of time putting out communications to our whole team. This is what we're doing. This is how we're handling it. Here's some reliable resources to get the information. And so going out to the floors, talking to our nursing staff, talking to our respiratory therapists. So we spent a lot of time doing that. And then when we saw, we pretty much shut down in March and went through April on a shutdown. And people who don't understand the hospital business, we rely on things like surgeries and imaging and colonoscopy to offset the losses we experience on the inpatient side. No hospital makes money on being a hospital. We're a nonprofit. All the money that we have comes back to our hospital, not to shareholders. People aren't getting bonuses off of it. It's there to support the hospital and our staff. And so we took a massive revenue hit, but we've been very conservative over the years, so we have some strength with our finances there. And we said, you know what, if we can, this is not the time to do a massive layoff or a furlough. And I don't have a giant hospital system backing us. And I'm very proud of the fact that we laid off less than a handful of individuals, and most of those were given the opportunity, do you want to do temperature screenings? Or if they had some health issues, we said, okay, fine, you go home and don't worry about it just now. We let people work remotely from home. And then in May, we gave everybody a raise, and I think that's been unheard of. And so I hope that people see that that's our commitment to our employees as a nonprofit, community-based hospital that's, fully controlled here. That's what we're here to do.
Built For the 21st century American workforce, Eastern Gateway Community College has 2 campuses and is a national leader in online learning. EGCC.edu is a digital gateway where 30,000 students are quickly transforming their financial futures through degrees, certificates, transferable credits, and higher-paying jobs. And now, residents of the Mahoning Valley can enroll in summer classes for free. It's the EGCC Summer Guarantee. Eastern Gateway. America's new workforce starts here.